Yo, 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 it's Trevor Noah, and we're talking about something super important today, healthcare in Africa. Specifically, we're diving deep into curative health. Now, this isn't about some magical cure-all. It's about how doctors in Africa are fighting the good fight against diseases and helping people get back on their feet. Think of it like this. You get sick, you go to the doctor, they figure out what's wrong, and then they fix it. That's curative health in a nutshell. But in Africa, it's not always that simple. We've got challenges, man. Access to healthcare can be tough, especially in rural areas. Resources can be limited. And let's not forget about the cost. But here's the thing. African doctors and nurses are resilient. They're innovative. They're out there every day, doing incredible work with what they have. They're diagnosing diseases, providing treatments, and helping people recover. So, buckle up as we explore the world of curative health in Africa. We're going to break down the process from diagnosis to treatment to rehabilitation. We'll look at the challenges and celebrate the successes. Because at the end of the day, health is wealth, my friends, and everyone deserves a fighting chance. Before you can fix something, you gotta know what's broken, right? That's where diagnosis comes in. It's like detective work, but for your body. Doctors use all sorts of tools and techniques to figure out what's going on. First up, we've got the basics, asking questions and listening to your symptoms. It sounds simple, but it's crucial. Then there are physical exams, where the doctor checks your vitals and gives you a once-over. But wait, there's more. We've got lab tests to analyze your blood, urine, you name it, x-rays to see inside your bones, and even fancy scans like MRIs to get a detailed look at your insides. Diagnosis is the foundation of curative health. It's about getting to the root of the problem so we can find the most effective treatment. And while it can be a complex process, especially with limited resources, African healthcare workers are constantly finding ways to improve diagnosis and ensure people get the care they need. All right, so the doctors figured out what's wrong. Now what? Time for treatment. This is where things get interesting because there are so many different ways to tackle a health problem. First up, we've got the heavy hitters medications. From antibiotics for infections to chemotherapy for cancer, these powerful drugs can target specific illnesses and knock them out. Then there's surgery, which can be anything from a minor procedure to a major operation. It's all about fixing things up on the inside, whether it's removing a tumor or repairing a broken bone. But it's not all about pills and scalpels, people. We've also got therapies, which focus on rehabilitation and improving your overall well-being. Think physiotherapy to regain movement after an injury, or counseling to help you cope with a mental health condition. The type of treatment you receive depends on your specific condition and what's available. But one thing's for sure, curative health is about finding the best possible solution to get you back to living your best life. Section 4. Staying healthy management and long-term care. So you've been treated and you're feeling better. That's awesome. But the journey doesn't end there. Long-term management and ongoing care are crucial for staying healthy and preventing future problems. Think of it like this. You wouldn't just drive your car without ever changing the oil, right? Your body's the same way. It needs regular checkups, healthy habits, and sometimes a little extra support. This could mean taking medication regularly to manage a chronic condition like diabetes or high blood pressure. It could involve lifestyle changes like eating healthier and exercising more. Or it might mean regular therapy sessions to keep your mental health in check. The key takeaway here is that curative health isn't a one-and-done deal. It's about taking an active role in your health, working closely with your healthcare provider, and making choices that support your overall well-being. Section 5. Life after illness, rehabilitation and recovery. Getting sick can be a real setback, both physically and mentally. That's where rehabilitation comes in. It's all about helping you regain your strength, independence, and quality of life after an illness, injury, or surgery. Now, rehabilitation looks different for everyone. It might involve physiotherapy to help you regain movement and coordination, or occupational therapy to assist you with daily tasks like dressing and cooking. Sometimes, rehabilitation also includes speech therapy to improve communication skills or counseling to address the emotional and psychological impact of illness. The goal of rehabilitation is to empower you to live your life to the fullest, regardless of the challenges you've faced. It's about regaining your independence, reintegrating into your community, and thriving after illness.